Well, I'll get a lot of patients in. I've been pulling up this magazine a lot lately from the today's Florida Dental Association because it has the perfect smile. And so when patients come in, I just look at them and I'll say, you know what? You could have the perfect smile. There's so many great things. Your midline is right on between these two front teeth. And these two front teeth are about 80% of your smile. You know, if we could just really focus in on getting two beautiful front teeth, then that is 80% of it. But these are the most prominent that people see, and these lateral incisors are so much smaller, and your eye kind of has to go from one to the other in a way where it's difficult to tell if they're that different. If we're really trying to figure out, you know, if we have to choose, we'll focus in on the two front and then kind of go out from there. They kind of get less and less important for each tooth type that you go out a notch. The other thing that is really nice about this smile is that the tips of the teeth are underneath of the lip, which I think is a helps support the lip, and we feel that that's a very attractive look. That the canine, which is very common, a canine will be stuck out over the corner of a lip, and you'll see this pointy canine right there. So to tuck those underneath is subtle yet profoundly important. And I find it interesting that whoever did this person does not possess this perfect of a smile, but it's been improved with Photoshop. So, and I can tell a little bit with the papilla, because this is, which a papilla is a pointy gum tissue. It's gum that is the point, and we call that a papilla. And I can kind of see that this was photoshopped in. It looks like a denture acrylic with the little strings, the little pink strings they put in it to make it look like real gum tissue with little blood vessels. So this right here is actually photoshopped in. So don't feel bad if you don't have papilla between your two front teeth. Pointy gum tissue, but it is very important for a really nice look. And there's a lot of things that we can do, but the perfect little pointy gum tissue is right above the third of the contact point on the tooth. And how we'll sometimes fudge it a little bit is make this, rather than a contact point, we'll make it a contact line, and the line will come up and the tooth will just be a little bit more square, and then we can kind of close off that papilla, and that's usually how we will handle a papilla, since papillas have pointy gum tissue, just has mind of its own. If it's gonna recede up and create a black triangle, it's gonna do it. There's, you know, a lot of gum grafting that's been done to corrected, a lot of other bone grafting procedures, and it just is elusive. So we've, you know, our profession has learned that this is the simplest, quickest way to manage that black triangle that you might have, but really between any teeth. But this one looks really nice. Also, the gum tissue is showing about a millimeter above the teeth, and that's considered to be the ideal gum line. Generically, the eye tooth is a little bit higher than the lateral, which this one looks like it is, and the central front tooth is a little bit higher than this lateral tooth. And the eye tooth, the canine, is a little bit taller and a lot more prominent because it's a cornerstone tooth. The other thing is the white tooth in the corner. So some people have a thin arch going back. Their arch of their front teeth takes a quick dive and goes straight back like mine. So I kind of sometimes pine for a little bit more white in the corners because my arch form just doesn't go out like that, like Julia Roberts. But for cameras and for movies, it's a very popular smile. So this is the perfect smile. Things that are not perfect about it though, and I'm going to have to talk to the Photoshop editor on this because they missed something, which most people actually have. Like I have a line angle that goes to the outer corner of my eye, but these little line angles go straight up and down, and they should probably go out to the corners just a little bit more. So even a Photoshop expert misses a thing every once in a while, so don't feel bad if your teeth go straight up and down. You still can make the cover of the Florida Dental Association Journal.